There's something that a term we use in healthcare called Cascade Iatrogenesis, which iatrogenesis means unintended consequences of our healthcare. My name is Amy Seipel. I have been serving the primary care needs of older adults in long-term care centers for over 22 years. One thing that's very important as I'm providing care is to always consider the risk versus benefit burden. That is critically important with all the treatment modalities that we use. I must also keep in mind the average life expectancy once someone enters a nursing home is about 2 years. So some people live longer, of course, but 65% of people will die within the first year. So quality of life indicators is critically important as I consider what treatments I recommend for my clients as I render care. It has changed dramatically. Now I will say when SARS-CoV-2 first hit the United States, I was concerned about my residents, very concerned about their safety. Now, when I first heard the mandates in March of 2020 saying that we were going to lock down for 2 weeks, well, that made sense to me. We knew what kind of risk our clients would face, again, because of the literature. In 2019, in fact, there was a report that was released by the CDC that showed that older adults who are in social isolation, their mortality risk is probably greater than the risk if they smoke, if they're sedentary, or if they're obese. So we know the mortality rate is high. We also know that you have, and according to this report, a 50% increased risk in dementia if you have social isolation, and a 32% increased risk of strokes. If you happen to have heart failure, you quadruple your risk of death if you have social isolation. So I had already read this report in the CDC prior to the lockdowns. I knew the risk going into this, and it made me very concerned, especially when it wasn't just 2 weeks. Well, when you create a bed-to-chair existence, you create the risk for falls. What's more, we deemed that physical therapy was non-essential too, and so physical therapists were pushed out of most of our buildings. So they were not able to work with our clients to regain their balance and mobility, and the research shows that seniors can lose up to 1% muscle mass every day they are bedbound. Think about that, 1% muscle mass. So they were completely set up for falls. We knew these were going to occur, and this is an important statistic. If my older adults in long-term care centers fall and fracture a hip, the data shows there is a 50% chance they will be dead in 6 months. That is once again to the hazards of immobility. But we created the hazards of immobility, which created the problem in the first place. So this was, I understood all these risk factors going in, and my heart was grieved, and I saw them playing out. There's something that a term we use in healthcare called Cascade Iatrogenesis, which iatrogenesis means unintended consequences of our healthcare decisions. So whether or not you give the wrong medicine and then somebody has an adverse reaction, but in this case, the lockdown. The cascade iatrogenesis is this medical complications that cause this circling, spiraling down effect because of what we did, and that was really, really hard.